Phelps. I am your hostess for tonight, and welcome to our webinar on perimenopause. Tonight, we are having a little moment of silence for us. Today is a special day. I'm going to share my screen so you can see what that is about. Okay. So today is also World Suicide Prevention Day. And in commemoration of that, I'm going to light a candle and observe a moment of silence because with perimenopause, we realize there are some women who suffer terribly from depression, and it is part of what they are suffering with because of this life stage, compounded with other things that may be happening in their lives. So, unfortunately, we have lost some women, sisters, mothers um, due to suicide. So, as a result, I am lighting this candle as the Trinidad Tobago Association of Psychologists have suggested. Okay. So, we observe a moment of silence and then we'll continue with our presentation. And in this moment, we ask for God's presence to be with us so we have a successful webinar. All right, so welcome everyone. I'm so glad that you could make it tonight and you've gotten our emails, because what's happening, we were having a little difficulty with emails, but I see that you have gotten on, so thank you. I'm going to ask something that's unique. It's a little bit different, and that is that in the participants box, now at the bottom of your screen, you'll see participants. Click on it, and to your right, you should see your name at the top. And with your name at the top, you should see when you put your mouse over it, 3 dots or more. Rename yourself, all right? And in renaming yourself, you're going to put your age. We're not going to know who you are unless you put on your camera, but we just want to see your age, because we're going to put everybody, we're going to try to get everybody into groups, but of groups of different age groups. All right, so we want people of like age groups or like age to be in the same group. So instead of you putting your name, I want you to go to your name in the participants box on your right and put your age. All right? And if you want to take off your camera, feel free. This is an experiment. Hopefully we get you with that experiment. Okay? And of course, this is Women's Talk. What is perimenopause? So we are expecting women to be present. Okay? And we are going to talk all about women and women's stuff. All right? And so please, again, if you're now coming in, put your age instead of your name. Okay? Rename yourself, all right, by going to the participants box and putting your age. Okay. All right. Thanks very much for those who did. You're doing a great job. Okay. So let's start. And I'm going to do a quick overview, and Dr. Ruberu will join us a little later, okay? But she's she's welcoming questions. So please, as we go along, get your questions ready for her. So here we go. I'm going to share my screen again, and perimenopause. What does it mean? Well, simply, it means around the menopause. So prior to, when a woman, a young girl starts her cycle, all right, that is in her menstrual cycle. Um, from that time until perimenopause, she has what we call sufficient estrogen that her body is using to maintain from head to toe her vision, her heart function, her bone building, everything. Okay. Now, around menopause, this time of perimenopause is a preparation for the end of that time of where she starts to bleed. So there is no more bleeding in menopause, which is the end of bleeding. Okay? In perimenopause, it's a time of great transitioning from this movement of having these good amounts of estrogen that again from head to toe maintain quite a few things in our bodies or keep it at a particular status. Now, in this time of transitioning, it is a change from things, from the way things were, and an irregularity in a woman's cycle in indicating declining fertility. So usually this is the first sign that she would see visibly that her cycle is starting to change, be it by a day or two, or many days, or the bleeds are changing, the number of days, the amount of time, and we're going to get into that. Why is this happening? It's an expected decline of estrogen as we age. Okay, so that decline, when it's reached that particular level, it's when you're in menopause, your body settles into that level. But prior to getting into that level of estrogen, which is a lot lower than when in reproductive years, from teenage years into the 20s and beginning of the 30s, that decline doesn't take place gradually, like just like that. It does a lot of fluctuation in the hormones. And in that fluctuation is where we see the signs of perimenopause. So some women glide through perimenopause, they hardly get any signs. Other women, oh boy, they may get all the signs. So sign, this is the sign you've been looking for. This is the most popular sign. That of the hot flushes or hot flashes. Flushes, flashes, same thing. All right. All of a sudden, she's feeling this heat all over her body, and nobody else in the room is sweating. Nobody else feels warm, just her. All right. So that is what we call the hot flashes. What is going on? So again, it's fluctuation of the hormones that are causing these flushes or flashes. Again, the signs, the very first signs are things like heavy or very little to no bleeding, even, right? Some cycles, it may not bleed for a month or two, right? And then it comes back. So it's a lot of fluctuation in the hormones that's happening that is causing all of these changes. Now, these cycles may be longer, they may be shorter. Uh, Bleeding in between the cycles may occur, right? Hot flashes or hot flushes, as I said, night sweats, insomnia, so can't sleep properly, and probably because of the hot flashes and hot flushes, but also it's a part of the hormonal changes that this insomnia comes. Low sex drive or libido, which we're talking about all of these signs, yes, but we're going to get into how much it impacts on relationships. And it does quite a deal, quite a bit. All right. Vaginal dryness, weight gain, especially in the abdominal area, and women are eating like normal and exercising like normal, and this weight is just coming on them, and they're like, what is going on? Okay, so this is a part and parcel of what's happening here because of the hormonal changes. Um, Tiredness, fatigue, it's part of it as well. Other signs that women have reported, and you see, sometimes it takes a while to realize that you're in perimenopause because these changes could be something that you thought is just happening because maybe you ate too much sugary stuff or you ate too much oily things. All of a sudden you're seeing acne and like, I have not acne since I was a teenager. What's going on? Right? So digestive issues, you're wondering if it's you just ate this little something, but the digestive issues, the bloating and so forth, they're coming back as though you were a teenager. Hair loss, dry skin, joint pain even. So sometimes even for the doctors, they're having difficulty trying to piece together. You're telling me, okay, your hair changing and you're having joint pain. Not much change in the cycle, but you did notice some change in the cycle. Now, forgetfulness and all that. Like some people they say, well, that could be because I didn't sleep properly, and then you didn't realize you're not sleeping properly because your hormones are changing. So it's a whole web of signs and symptoms of this perimenopause, but it's a natural phase. Perimenopause, it's a natural time that your body goes through. However, it can be quite rough for some women, so this is why we're talking about it. We're wondering, well, am I going to get some? Am I going to get all? And you'll send some beautiful questions, all kinds of questions. But as I said, I'm covering some, and then Dr. Ribeiro will cover the rest. Okay. And in the questions you've been asking, can you become pregnant at this stage and this kind of thing? Yeah, because the hormones aren't completely gone. The estrogen is still there. It's just that it's fluctuating, and so, but these things are happening and giving you signs and clues that your cycle is changing. Questions that have been asked as well as when does this start, and this can vary. Okay. Typically it's in mid 40s going into the 50s, age 40 going into 50. But from the time a woman reaches about 30, sometimes this is already where she's in perimenopause. But every woman is different. And you need to start asking your family members, your mother, your aunt, when did you go into menopause? Tell me about that. Because it's got a familial aspect to it. It could be in the family that if they have had early menopause, then you can very, very likely have it too. Okay? So some women get it earlier, some women get it later. Some women get it because of their life stage, but also some women get it because of reproductive illness and having to treat with that. So let's talk about the feelings and relationships, the feelings and the related relationships, right? When I say that, irritability and moodiness could be, again, one of the early signs. So crying for a very simple ad on TV, in these COVID times, instead of reacting like everybody else, you are overreacting and you're starting to notice it yourself. Say, how come what is going on with me? How come I'm being so overreactive? And it could just be this. Yeah. We are in difficult times, however, with the COVID, and we do have to recognize that, it will impact on people differently. But that, in addition to being in this stage of life, which can be from every woman is different. For some women it's 2 years, for some women it's 10 years that they go through perimenopause. They said some women they start earlier, right? And some women start just in their 40s, and mid 40s is where it's anticipated. Okay, some women it's later on in their 50s. Every woman is different. But when you're looking for the signs, you'll be able to clue in and, of course, go see your doctor. So these times, though, when you're feeling this irritability and moodiness and all of these things happening, it's going to impact on your relationships as well. So women in this phase may feel unloved. And in feeling unloved, it may be because of their life stage. Remember, this is around their mid 40s. The children may be leaving home, right? Going off to university, or they're just leaving the house because they figure, well, I'm 18 and time to go, right? So there may be an empty nest syndrome happening there. So they're feeling unloved and kind of empty inside and that kind of thing. They may no longer feel beautiful or desirable. Why? Because she's going through all this thing where she's gaining weight in her abdominal area. She's feeling irritable. She's probably upsetting everybody in the household. All right. So she's not feeling beautiful. She's not feeling desirable because she's just feeling miserable. Literally, she's feeling miserable. Okay. So these are all related to the thing of perimenopause. She may be feeling tired, fatigued. Well, sleep disorders are common with perimenopause. So if she's not sleeping well, of course she's going to feel tired. The hot flushes may be keeping up at night. All right. So tiredness may be a part of this as well. Difficulty with intercourse. So intercourse may be difficult due to vaginal dryness. So again, one of the effects of the estrogen prior to was to keep that area moist, but now intercourse is miserable because of this dryness that's happening. Um, Anxiety. Well, along with the couple's concerns for their health, right? Employment, finances, etc. You have this on top of that. You have this additional anxiety of wondering, I wonder if I could get pregnant with a lanyard child at this time because yes, you can get pregnant during perimenopause. Remember, it's a gear up to menopause where you will no longer be able to get pregnant. Menopause is a stage where there's no bleeding, right? But that only happens after a full year of no bleeding. That's when you are now termed as menopausal, right? But only in that stage in menopause is when we can say, well, pregnancy is not possible at this time or very rare, very, very rare. If at all a woman can become pregnant at that time. Okay. But perimenopause leads up to menopause, and menopause is confirmed when she's no longer bleeding for a full year, right? But that anxiety of the changing or fluctuation of the cycles, not knowing which cycle is fertile, meaning she can't get pregnant in this cycle, next cycle, she may not be able to get pregnant because the cycle going on with no bleeding, no ovulation, and so forth. But that anxiety is there because she's unsure. She may feel sad. Why? Well, because she realizes that that ability to bear a child is lost, right? So perimenopause is a sign of, oh, I'm getting older. I'm feeling at a loss here because what I that ability to have a baby, it's gone. You know, it's going or it's gone, right? Um, At the same time, she may be feeling tired and unwell due to the bleeding episode. She may be having heavy bleeding and so forth from time to time, and she may be feeling sad because of all of this happening, all these changes in her body. So the risk factors for early menopause are, as I said, some women can get the menopause earlier. Smoking. Menopause can come 1 to 2 years earlier because of smoking. Family history, as I said, if it's in your family that your mother and grandmother had early menopause, then it could be just something handed down. Cancer treatment has been noted to cause early menopause. Hysterectomy. Now, hysterectomy is, of course, when the womb is being removed, but hysterectomy is that keep the ovaries in. The woman is not going to experience menopause. She's not going to experience menopause right away. She'll experience it in the time that she would with even with the womb. All right. Now, hysterectomy without meaning the ovaries were removed in addition to that. Now that is straight off menopause because that is what menopause is. See, the ovaries have the estrogen, right? And they produce the estrogen. So the estrogen keeps us, as I said, from head to toe with certain balances in our bodies, right? And perimenopause is the transition when the hormones are fluctuating and eventually the estrogen gets down to a very low level in menopause. But with a hysterectomy that removes the ovaries, which produces the estrogen, then the woman goes into automatic menopause. If if one ovary is removed, she goes into a gradual perimenopause and then menopause. But it can happen earlier because one ovary was removed. All right. So that's the difference there with the menopause with hysterectomy. Premature ovarian failure, on the other hand, is where the ovaries are failing earlier than they're supposed to. So who can this happen to? Even teenagers, even teenagers, women suffering with endometriosis who have had surgery where the endometriomas or growth tissue is on the ovary. Again, the ovary is producing the estrogen. And on the ovary, they remove either part of the ovary or the whole ovary. Yes, she can get what they call premature ovarian failure, which leads her into menopause a lot earlier than the average person. Okay? So common effects of menopause are increased risk of cardiac disease and decreased bone density. Okay? So this is the unfortunate thing that happens when we lose that beautiful estrogen that we had in our reproductive years. Okay? Complications where you need to get to a doctor right away. Complications include extremely heavy bleeding, bleeding longer than 7 days. You got to get to a doctor if that's happening, and bleeding less than 21 days apart, and you're bleeding that often. Yeah, you're having bleeds less than 21 days apart, you're having that often. That is a complication that you need to go to your doctor and deal with. So it's important, ladies, that you educate yourself. Don't be afraid. You're not alone. Okay, as you can see tonight, there are many other women here because they all have the same kind of questions, but this is a normal phase of a woman's life. Learn the Billings ovulation method, and you know our website now that you've registered with us, because the Billings ovulation method tells you about your cycle. Your cycle becomes so much more clearer to you. You have a lot more information. Your doctor is going to love the fact that you know your body so well, and they don't have to worry or ask even, because you could even present them with your chart, right? And you can present them with your chart over your phone even. So when you learn the Billings ovulation method, there's no involvement of drugs or devices or side effects. So it's an easier and simpler and less problematic. When I say that, when you're looking at side effects and so forth of other treatments that can treat the symptoms of perimenopause, well, we're not treating anything, but we're looking at what's going on with your body. And when we're seeing what's going on with your body, you can even guide your doctor, give them some idea as to what's happening in your cycles. Okay? So learn the Billings ovulation method and know a lot more about your body when you're actually ovulating and when you're not, when you're releasing an egg and when you're not. So that anxiety about pregnancy, you're dealing with it effectively by learning this method. Balance your hormones by eating healthy, right? When it comes to balancing your hormones, exercise is key. So you need to keep up with your exercise, keep up with your healthy diet, get some sleep, ladies. Get off of these devices, right? At least an hour before getting to bed. Try your best so that you can get as much sleep as you can. These things help you to balance your hormones. So all those side effects, those signs and symptoms of the perimenopause that I described, they will impact you less if you do the best that you can with your diet, exercise, and sleep. And pray and meditate. Keep yourself calm, because even though your hormones may be doing these things, keeping yourself calm helps in your keeping everything in check. All right. So you're giving your body the best bet that things don't get out of hand, that your emotions don't get out of hand. Meditate every day, pray every day, because it will help in keeping that calmness, that you don't go to the extreme of anxiety where you have to be on drugs for that, or to the lows of depression where it can end up very sad indeed. Visit your doctor. As I said, you can even show them your Billings chart on your phone nowadays. All right. Um, and seek counseling if you need it. Um, the moodiness, the irritability of uh, the perimenopausal time for some women have already impacted their relationships, and they may need counseling. The couple may need counseling, or the woman may need counseling on her own to come to terms with how much it has impacted her life already. As I said, perimenopause could be 2 years, it could be 10 years. Can you imagine, with all that fluctuation happening, what damage could be done in relationships? The Family Life Commission, who we're grateful for having the Zoom session tonight, um, they have counselors available, and counseling psychologists even, who they can treat with this issue and give you excellent advice. And those are some of the questions we got. Where do we go to for advice? Well, when it comes to personal relationships, Family Life Commission. When it comes to family life on a whole, we're talking these days about bringing God into your family life, because we're mostly at home these days. And it's so important. It's so important. Get onto the Family Life Commission website, and all of their social media handles, and learn more about how to keep your family at peace in this time. The Tran Tobago Association of Psychologists, psychologypt.org. They have a red button on that website that if you need to talk to a counselor right away, you click on that and you get the numbers for people from 8 a.m. to 10 p.m. who you could talk to about what's happening in your life, how these hormones are impacting upon you, or these fluctuations, and so forth. And of course, as I said, you have us, right, to turn to look at what's going on with your cycle, help you to interpret the different changes, and when you need to go to a doctor and so forth, we're here to help. All right. And our information is available to you free of charge. Our consultations are free of charge. Okay. So I'm going to stop sharing my screen, because this is about the time when Dr. Ribeiro is going to join us. Yes? And hello, Dr. Ribeiro.
Hello. Can you
So
hear me
nice to
okay?
have you. Yes, we can hear you very well. Thank you for joining us. So Dr. Ribeiro is joining us from Pennsylvania, USA.
Correct. Yeah.
And I would you like me to give you a bio, Doc, or would you like
Sure.
to
Go ahead. Go
follow?
ahead. Yeah.
Okay. So Dr. Ribeiro is an obstetrician gynecologist who we had met through the Joy-Filled Marriage program, and we're so grateful for that program, which has the truth of who we are as human beings, first and foremost, and then in the couple relationship, who we are as a couple in God's eyes, right? And what it is to be a family, and what is God's plan for family life, right? As a couple, and then with children, and even without children, right? So Dr. Ribeiro is a daughter of the king, as she describes it, a wife to an amazing husband, and a mother to 5 adorable children, 2 in heaven. God rest their souls. She's a convinced Catholic and a naprotechnology trained, um, sorry, naprotechnology trained pro-life obstetrician gynecologist. Dr. Ribeiro has a beautiful conversion story, which I'm not sure she will get into tonight, but it's called Rising with Roses. It's published. And she has a very precious relationship with God, because she went from a broken marriage into a faith-filled marriage. Yes. And she also recognizes that the pro-life movement in the US, where they have the 40 days of life, I think it just ended. Um, she is part and parcel of all of that. And she loves speaking about making the most of your marriage, and dating, and sexual integrity, NAPR technology, which is, let's say Billings does the basic stuff about, well, what does your cycle look like? NAPR technology takes it to another level, where the information that is received in your cycle now, naturally, those doctors are going to do a lot more with it. So I'll let Dr. Ribeiro talk about that. And alternatives to contraceptives, IVF, and typical gynecologic care. So Dr. Ribeiro, thank you for joining us tonight. Over to you. Thank you so much for your presence.
No problem. I am so excited to be with all of you. It's really funny because I actually visited Trinidad when I was in medical school. My cousin was in medical school at the Women's Center there. He was doing his rotations, and I came down for a gynae rotation at your women's hospital. And it was really quite an experience. I enjoyed it. So I am very familiar with your home, and it's just so happy to be talking to all of you tonight. I used to practice as a typical gynecologist. I used to write for contraceptives, place IUDs, do all of those things, because that's how I was taught to practice in my training. We were never taught anything about any form of natural family planning. We were always taught that it didn't work, which was a complete lie. I think the majority of medical schools in the States, definitely, I remember even in Trinidad when I was kind of working there for that few months, it was all, the education was, when it came to gynecology, was all about the use of contraceptives and how you should, if basically any problem that comes across, you should utilize contraceptive pills to shut down the cycle and deal with the symptoms. But I'm adamantly opposed to that at this point in my life. And thanks be to God, now I have an understanding of NAPR technology. And like she was saying, NAPR technology began with the Billings method. So in the Billings method, identifying what your bleeding pattern is, and then what your mucus pattern is, what the length of your cycle is. And Crichton Fertility Care Natural Family Planning charting took that basic initial charting, and what they did is they looked at all of the different women who had these charts, and they realized that certain women had certain kinds of charts. So women who were suffering with endometriosis, which is when little bits of the inner lining of the uterus implant outside of the uterus, and they cause severe pain during the cycles, those women tended to have spotting before their periods. When women had polycystic ovarian syndrome and they were having difficulties conceiving because they didn't know when they were ovulating, those women all had similar cycles as well. They would have very long cycles, or cycles that were more than 30 days, and they would have very irregular mucus patches. And unless they were charting with Crichton, they really would have no idea when they could possibly conceive, or when they, if they were trying to space their pregnancies, when they would come together with their spouses to avoid pregnancy. They also noticed that women who had recurrent miscarriage or severe PMS or really irregular bleeding with shortened cycles oftentimes had lower levels of progesterone. And they knew this because once they identified the peak day or the place in the charting where they were very close to ovulation, then they realized that all of the estrogen levels had a certain pattern before and afterwards. So you could basically say, okay, 3 days after ovulation, my estrogen should be this. And they were able to compare their levels to what was normal. And then because they were able to scientifically compare those things and come up with what normal was across the board when people had completely normal cycles with normal pregnancies and no GYN problems, then they were able to really understand what is normal, what is abnormal, and chart it all out and bring it to like a very systematic method so that people could figure out if their cycles were normal, if their cycles were abnormal, and where those abnormalities lie. So I think it's super, super important to pay attention to these things, because it's not just about your bleeding patterns or everything else. Like she was saying, the perimenopausal symptoms that affect women, you know, sometimes starting in their 20s, sometimes even starting in their teens, depending on what their hormonal function is, that can really affect your mood, the way you feel, your fatigue, anger, irritability, headaches, bloating, all of these PMS symptoms that oftentimes can occur right in that week or so right before your period. They can sometimes be so disruptive to your life, to your work, to your family life, to your marriages, to your relationships, to those who are closest to you. It can be very, very difficult. So what I would suggest to all of my patients is, number one, take the time to actually keep track of what's going on in your cycle. Just simply by writing down the first day of your period every month in your calendar, then you'll be able to get so much information. And then hopefully, if you were to join and learn the Billings method or learn NAPR technology, learn Crichton fertility care, natural family planning, one of the natural family planning methods where you can identify when you have mucus, how much mucus you have, all of those little tiny things that take about not even 2 minutes when you go to the washroom. Basically, you're just folding white tissue and you're wiping yourself from top to bottom, and you're just making a quick observation at the time that you go to the washroom. And you're just saying, you know, as I'm wiping myself, does it feel like I'm wiping an egg off the table or no? Does it feel like it's dry as my hand is moving? When I look at the tissue, is it dry, is it wet, or is there something shiny and mucousy? And if there is something shiny or mucousy, when I touch it, does it stretch? And if it does stretch, if there's anything shiny, then most likely you're in that fertile patch. And you know that if you're in that fertile patch, soon after that ends, that's when you're going to be heading into that PMS time. Having an understanding of when that time is, if you have a physician who can work with you, who has an understanding of natural family planning methods, they will understand exactly when to draw your blood in order to check your hormonal panel. Because it's very important to have an understanding of, after you ovulate, what do your estrogen and progesterone levels look like? So every single month when you ovulate, you are releasing an egg. And when you release that egg, what happens is, what's left behind is a corpus luteum cyst. So you've released this egg, the egg goes off and is ready to be fertilized, but this corpus luteum cyst is still sitting here. And this cyst's job is to pump out estrogen and progesterone. The estrogen is like the cement, and the progesterone is like the bricks in a wall. And so the estrogen and progesterone combines to create this little wall of lining within the uterus, and it's stabilizing it, waiting to see if there's going to be an embryo, a little baby that comes to implant in it so that it can support that embryo. But then if there's no pregnancy and the hormones go away, then that lining will start to shed. But this corpus luteum cyst, if it's not healthy, then it won't produce enough estrogen. It won't produce enough progesterone, and that lining cannot be stable. So then you'll have a shortened period of time. Instead of the normal length of 14 days after ovulation, it gets shorter and shorter. And that's how you end up with 26-day cycles, 25-day cycles, tail end brown bleeding at the end of your periods. All of these things are signs that we pick up if you're charting and if you're paying attention to your bleeding. So whenever I see women in the office, the first thing I ask them is, how many days are you bleeding? If you're bleeding for more than 5 days, there's very good chance that you have some sort of an abnormality, because you've probably got either spotting before your cycle or spotting after your cycle. And then the next question I ask is, what's the quality of your bleeding? So the first day, is it spotting? Is it light? Is it moderate? Is it heavy? Is it very heavy? And, you know, a lot of people will think, oh, my heavy might be different from your heavy, but you have to actually quantify it. So if you're using a pad, or if you're using a regular size tampon, it would be considered very heavy if you're having to change it every 1 to 3 hours. It would be considered heavy if you're changing it every 4 to 6 hours. It would be considered moderate if you're changing it every 7 to 9 hours. It would be considered light if you're changing it every 10 to 12 hours. And then it would be considered spotting or just smearing if you're just wiping yourself and you're seeing a little bit of blood at that time. By having an understanding, you would then be able to realize, if you're somebody who has like multiple days of very heavy bleeding where you're passing large clots or you're soaking through a pad an hour, that's not normal. So there's a cause for that abnormality, and you have to go looking for that cause. Is it a structural cause? Do you have fibroids? Do you have polyps in your uterus? Do you have a hormonal dysfunction that's causing your lining to overgrow? Do you have too much estrogen? And so having too much estrogen will sometimes push down the progesterone, and so that will lead to problems. So all of these things you can absolutely find out easily if you know these little facts, like when your period starts and when you might be ovulating and how long your cycle length is and what your bleeding pattern is, because then you can talk to the physician and they can hopefully guide you and help you to understand these things. And so if you find these things, what can you do about it? There's so much you can do about it. There are supplements that you can take. So if you are a person that, you know, has tons of fibroids in your uterus. Fibroids are caused by higher levels of estrogen. Breast cancer is caused by higher levels of estrogen. Polyps in the uterus are caused by higher levels of estrogen. So if you're somebody who has higher levels of estrogen, you need to figure out, where are those estrogen levels coming from? One cause is something called xenoestrogens, X-E-N-O estrogen. Xenoestrogens, if you Google it, you'll get a whole list of chemicals. That's X-E-N-O estrogens. You'll get a whole list of chemicals that may be in your shampoos, maybe in your conditioners, maybe in your body creams, maybe in your plastic containers, maybe in the fertilizers you're using, you're growing in your garden. So watch out for these chemicals, because these xenoestrogens will enter into your food. They'll enter if you're cooking with plastic, or if you're heating things up in the microwave in plastic, or if you're washing things in the dishwasher in high heat with plastic. Those plastics can leach the chemicals into your food. If you're drinking from plastic water bottles, then, you know, sometimes those water bottles have been sitting out on a dock somewhere in the heat, and they can get heated up, and those can leak these chemicals into the water that you're drinking. So if possible, you want to try and, you know, get a good like Berkey metal filter in your home so that you can boil your water and then you can put it through the filter and keep that sort of water in your house for your cooking, for your drinking, all of those things. But you have to really watch out, because these xenoestrogens will stimulate your body to create more estrogen and raise your estrogen levels up and cause all these extra issues. So that's one cause. Sometimes people just have innately high estrogen. Sometimes it's because, you know, I remember visiting in Trinidad, almost every street corner had a KFC. And I knew it was very, very popular in Trinidad. And as it is here in Philadelphia as well, there's a lot of processed foods, a lot of fried foods. I would highly suggest considering looking at plant-based diets for even a short period of time to give your body a rest and allow your body to cleanse itself. And I know when people think plant-based diets, they think, oh my gosh, it's going to be so boring. How could I give up my meat and my eggs and my dairy and my cheese and everything else? I've been doing it for a month and it's been fantastic. So there's a fantastic documentary and it's called The Game Changers. You can access it for free on YouTube and you can look it up. And it's all about plant-based diets and the benefits of plant-based diets and how, you know, you can utilize that to help your body have a rest, to lower cholesterol levels, to lower inflammation in your body, to help your body be healthier. And even if it's just that you do a plant-based diet for 1 week out of the month, just to give your body some relief, that's better than nothing, right? So oftentimes the things that we're eating, you know, if we're eating processed foods, if we're eating things that have pesticides on them, if we're eating fruits and vegetables, but those fruits and vegetables have pesticides on them that have seeped into the fruits and vegetables, then you're getting to eat all those pesticides. And all of those things are so bad for us. They're cancer causing. So you just want to really be careful in exactly what you're eating. And I know maybe it's not possible to eat, you know, all organic fruits and all organic vegetables, but as much as possible, trying to eat things that you know how they've been grown, you know the person who's growing them and all that, to have the healthiest possible way of doing it. Now, if you do these blood tests and it shows high levels of estrogen, there are certain foods that you can eat to counter those estrogens. Broccoli, cauliflower, kale, the cruciferous vegetables, Brussels sprouts. Those 4 vegetables, there's actually a supplement called DIM, D-I-M, that you can take to counter high levels of estrogen. But I would only do that if you had tested the blood levels after ovulation and you know that your estrogen levels are high. If you're somebody who has fibroids in your uterus, ovarian cysts in your breasts, and you're having very heavy bleeding, there's a very good chance that you have high levels of estrogen. If you're somebody that has PMS symptoms that are bothersome every month, right before your period, you tend to get into disagreements with the people that you're hanging out with, and you are just irritated by your children and the people that are around you. You have mood swings, you feel like getting away from everybody else, you're very fatigued, you have breast tenderness, you have leg swelling, and you have headaches, then there's a really good chance that you have a lack of progesterone. If you have a lack of progesterone, you will either see really long cycles, like with polycystic ovarian syndrome, or you'll see very short, frequent cycles, like 26 days, 24 days, and you'll see that at the end of your period, you have tail end brown bleeding that lasts for at least 2 to 3 days. And it's very irritating because you go from this prolonged bleeding to a couple of days off to PMS symptoms to prolonged bleeding. And it's just that over and over and over. Oftentimes these poor women are diagnosed with depression and with anxiety, and they're put on antidepressant medications and anti-anxiety medications. But all those things do is they put you in like a gray zone. They don't allow you to be happy. They don't allow you to be sad. So it's what they really need is to have somebody who will evaluate their hormones and then actually address the underlying hormonal issue. And then that would be super helpful. I've had a lot of women who've been in this position, and then once they get on some progesterone supplementation at the correct time, if you take progesterone every day, you're completely messing it up. And oftentimes people will be told by the natural physicians or the natural, you know, herbalists or whatever, oh, just take this progesterone oil or take this progesterone cream and use it every day. And that is the biggest mistake you could ever make, because God created us in such an amazing, intricate way. And there is such a ballet dance to our hormones, but it is very much planned and with purpose. So the second half of the cycle after ovulation is the only time you should ever have progesterone. And so you need to be able to use the Billings method to identify where you're ovulating so that you would know when it's okay to evaluate your progesterone levels and when it's okay to take your progesterone. Progesterone you can get from a variety of sources as well. So there are progesterones that you can get from the pharmacy, from your doctor prescribing it for you. And that's like the generic brand progesterone. But then there may be, I don't know if in Trinidad you guys have compounding pharmacies, but sometimes from here, you don't. In the States, we have compounding pharmacies where they actually have progesterone that you can get derived from yams. You can use seeds for progesterone. So certain kinds of seeds like sunflower seeds and sesame seeds have progesterone in them. But when you're using those seeds, you want to make sure that you get organic seeds and that you grind them and that you put like 2 tablespoons of the seeds into like a smoothie. So you get your blender and you fill your blender with spinach and with kale, and then you blend that up with like a mug of water, and then you add a banana and you add some berries and you add some, you know, frozen fruit, whatever fruit you want. And then you put in your seeds that have been broken apart and mashed up, and you drink it as a smoothie. And you, what if you are drinking sodas, and if you are drinking juices, and if you are drinking coffees and teas, you need to quit it. You have to switch and drink water, because your body is dehydrated and your body needs to be cleansed, and you have to be able to allow your body to heal from all of the issues that your body is dealing with, from all of the food and everything else. So you've got to really just offer it up to God, pick somebody that you're praying for right now, and offer this as a sacrifice for that individual. I'm sure each and every one of you have somebody in your lives that is very important to you who is suffering in some way, and you can offer up, you know, okay, I'm giving up all sugar for this individual, or I'm giving up all the soda I ever drink for this individual. I'm giving up all the juice I ever drink for this individual. And I offer all of the graces that come from giving up those things to protect the temple that God has provided me with, to respect this temple, because He's created each and every one of you beautifully, perfectly, with such intention. He has so many jobs in mind for you to accomplish during your lives. And if you don't take care of the temple that He has given you, it's basically like slapping Him in the face and telling Him that the creation that He made isn't worthwhile to respect in that way. So every time that it comes down to it, it's our responsibility. And I am, you know, I'm not speaking from a place of I've always done the perfect thing and I've always made the right choices when it comes to my own diet. I love sugar and I love chocolate and everything else, but I absolutely, I have a nephew right now who's very ill, and he's, through the grace of God, he's being miraculously healed, but I'm sacrificing things for him so that God will pour down every possible grace on that child and to heal him completely. So like that, I think it's been so redeeming and helpful for me in my ability to give up those things and to be able to try and live a healthier life to honor God through my body as well. When you make those changes, as hard as they may be, you will end up feeling so much better, because when you actually, you know, have a healthy diet, drink enough water, you're going to be having good bowel movements every day. You'll be eliminating the toxins that are in your bodies. You'll be able to absorb the good things that are in your food and eliminate all of the bad, right? When you exercise, then you'll have more energy. You'll be able to move around. You'll have more strength to do the things that you're called to do. And then you'll be able to enjoy life so much more. I'm sure each and every one of you have people in your lives that you want to be around, that you want to support, that you want to take care of. And you've got to attach the good things of those people with all of these new habits. The hardest thing, like when people are smokers or when people have an addiction to food or an addiction to alcohol, the reason why it's so difficult to break those addictions is because you associate that addiction with happiness, with joy, with peace. with love, right? If you can break those connections and really attach to the bad things in your life, that you're trying to eliminate those things, if you can actually attach those things to badness and then attach the good outcomes that you want to the goodness, then you'll have a much easier time trying to break those habits and choose something different for yourself. So when you're looking at your cycles, when you're looking at your moods, don't, I have a lot of patients that come in and, initially when I ask them, do you have PMS symptoms? They say no. And then it's only when I dig deep and I start to ask them about their bleeding patterns, about the length of their cycles, about, all of these different things. And I'll say, really, are you certain you don't have any PMS symptoms? And then I'll go into the different, symptoms that they might be experiencing, the headache, the, feeling like they want to get away from people, the increased anxiety, increased depression, increased mood swings, the change in bowel movements, the crampiness in their bellies, the swelling in their legs, the breast tenderness, and the headaches. And they'll say, oh, yeah, I do have all those things, but I thought everybody had that. People shouldn't have it. A lot of people do have it. And just because everybody around you has it doesn't mean that you have to settle for it. There are things that you can do to have a better understanding of what's going on in your body. And there are things that you can do to evaluate what the abnormality is. And then there are things you can do to replace and to help your body get to a better place so you're not feeling that way. But the majority of times when you go to a physician and you tell them about these things, the first thing they're going to offer you is birth control pills to try and shut down your cycle. Because they'll say, well, if you take the birth control pill, then you won't be dealing with those symptoms. But all the birth control does is it hides the problem, doesn't deal with the underlying issues. So what you need is to find, I'm sure there must be at least one doc in Trinidad that's doing things slightly differently. If not, I do have coaching sessions. I can't write for prescriptions, but I can, talk to people and get an understanding of what your health history is and give you a detailed workup of exactly what tests you need so that you can walk into your doctor's office and say, I've been doing some research and I have an understanding of my cycles and I know that I ovulate on this day, and I would like you to write me lab tests for estrogen and progesterone on this day, this day, this day, this day, and this day. And they'll be like, what? And you say, yeah, I need you to write me blood tests for estrogen and progesterone on these 5 days. And then I will share with you, what my coach says about those days. And I'd be happy to, if you could help me and advise me on ways that we could maybe address these things. And if you don't know how to do it, naturally, then at least I can have an understanding of what the deficiency is. And then I can see if I can naturally address those deficiencies. But the first step in all of this is having an understanding of when you're ovulating so that then you can understand what's going on when, right? And some of you might not be ovulating. If you have polycystic ovarian syndrome, it might be very rare that you're actually ovulating. And you really have to look out for that mucus to have an understanding of when you're ovulating. But the minute that you know that timing of the ovulation, that is the key. You can then know when to do blood tests. You can know when to take possible seeds. You can know when to eat certain foods to improve your situation. So I think I've been rambling for a long time. So if you guys have any questions, and if you're able to unmute yourself, let's see maybe if you want to put questions in the chat box, I'm happy to answer any questions if people have specific ones.
Okay, so we'll open up to questions right now. And thank you, Dr. Rivero. My computer went off a little bit, but I was able to get most of your talk there, and it was very much on point. We're exposed to so much, and we don't know how much is impacting on our hormones. But we thankfully live a very let's put it this way, we living a very simple life now because of COVID, right? So and things are going to get simpler as time goes on, it would seem. And so we're going back to, back to the farm, back to the garden, so the
Wonderful.
home gardening, yeah, home gardening projects, what the archdiocese have been doing. And so we got a first question here on the chat. Let me just
Yeah.
take it.
So the names of the seeds. So if you do blood testing and if you find out your estrogen levels are low, then the estrogen seeds that will help you boost estrogen are flaxseed, pumpkin seed, and chia seed. So all of those seeds, you want to make sure that you get organic seeds if possible and that you have them ground. And if you can have them ground, then you can mix them into foods, but they're much more potent that way. And then for progesterone in the second half of the cycle after ovulation, the seeds that increase your progesterone levels are sunflower seeds and sesame seeds. I've been going through this since February of this year. I got blood work done, but my hormone levels were okay. So for 42, I'm not sure exactly what your name is, but typically what happens is when you ask your physician to check your hormone levels, they will check like a day 20 estrogen and progesterone. But that level means absolutely nothing unless you know where you're ovulating and what that lab day is in relation to ovulation. Because if you draw a random estrogen and progesterone and you have no idea where in the cycle you are in comparison to ovulation, you have no way of knowing what true normal is. But if you know when you've ovulated, then you'll know that 7 days following ovulation, your estradiol should be a certain level, your progesterone should be a certain level, at 3 days following it should be a certain level. And those levels are all different. So really important that you speak with someone who actually has an understanding of how to interpret those labs and has the ability to interpret those labs in relation to your cycle. And oftentimes, when I'm checking estrogen levels and progesterone levels, the first thing I do is on day 3 of the cycle, I will check for polycystic ovarian syndrome. I will check for thyroid dysfunction. I will check for prolactin abnormalities. I will check for 17-hydroxyprogesterone. So there's a slew of labs that I will look at on day 3. And then I will go on and check starting right when that mucus starts to appear and the estrogen starts to rise. I'll start checking estrogen levels. And then when ovulation occurs, I'll check estrogen and progesterone levels. So that's like an additional 12 lab draws as well to look at all the hormones. But without doing at least some of that, it's hard to say. And the other thing is with thyroid abnormalities, oftentimes the ranges that they give from the labs are very, very wide. So I look at a much more narrow range because in pregnancy, they say your TSH level shouldn't be more than 2.5. So I use that similar sort of range for outside of pregnancy. And what I found is oftentimes if people are symptomatic, if they're feeling tired, if they're feeling constipated and just foggy, and they have a thyroid dysfunction, even if they're within that same normal range according to the lab test, oftentimes their thyroid isn't functioning very well. And they may have an issue with their thyroid that you have to look deeper. But it's a little challenging if you don't have a physician who's willing to really jump in and look. Okay, so let's go back here. What are the symptoms of ovulation? Okay,
Um,
yep.
Sorry, Dr. Rivera, but everybody has a number because we asked them to put their age instead of their name. But if you want them
Ah,
to put
lovely,
their
lovely,
name,
lovely. Okay, that's great. All right.
you,
Um,
mhm.
so ovulation symptoms. So some people can feel ovulation, some people can't. So sometimes at the time of ovulation, you might have a pain on the right or the left side. But leading up to ovulation, when you wipe yourself, when you're going to the bathroom, before and after urination, before and after a bowel movement, you're going to experience that you have like the sensation that you have when you're wiping an egg off the table, that sort of lubricated feeling. That's the sensation you will have when you wipe yourself when you go to the washroom. And then when you look at the tissue, there'll be something shiny or there'll be something mucousy that you could stretch if you were to touch it. And that is the fertile mucus that's leading up to ovulation. And the reason that that is there is because as your estrogen levels rise, it causes the release of this mucus. If you're trying to conceive, that mucus is the highway for the sperm. So if you don't have that mucus, that's a possibility of cause for infertility. And if you're trying to conceive, there are things you can do to increase that mucus as well. Just certain like over-the-counter medications can help you with that. But that's really the main sign for ovulation. And then following ovulation, if you have low levels of progesterone, you might experience the PMS symptoms. So let's see, I have extremely heavy periods, so chances are I have extra estrogen. Yeah, chances are that you do have extra estrogen, because if you have very heavy periods, there's a good chance that you might have fibroids in your uterus. There's a good chance you might have polyps in your uterus. Or there's a good chance you might have some sort of hormonal abnormality that's leading you to have really long cycles. So your estrogen is building the lining for a much longer period of time. So when you finally ovulate, the thickened lining is going to shed, and that'll be a heavier period than somebody who has less estrogen exposure and a thinner lining. Thanks for answering, because they send you for blood work but do not explain all this. Yeah, I get that. I have been to so many doctors and they keep saying that I'm too young to be in perimenopause. So they have chalked it up to anxiety. Sigh. I'm sorry. You're 41 years old. So anybody after the age of 40 is actually considered perimenopausal. And so you're not too early to be in perimenopause. And oftentimes people do have hormonal changes starting around this time. And I've seen people with hormonal changes earlier than that as well. I'm 43. I never had my period the same time a month. Yeah. So typical normal, like a completely normal period is a period that happens every 28 days. Still normal would be 27 to 29. If you get over 29 days, then I get concerned about thyroid dysfunction or polycystic ovarian syndrome or problems with prolactin level. If you get under 27 days, I get concerned about problems with lower levels of progesterone. So it's really a good idea to chart your cycle with the Billings method, have an understanding of when your periods begin, have an understanding of exactly what day of the cycle they're happening, how many days they're lasting, how heavy they are, when you're getting that mucus so that you know that you're ovulating, what the length of your cycle is there any mid-cycle spotting ever, do you have spotting when you have intercourse with your spouse, all of those things, do you have pain in your cycles, do you have mood changes, just get out a diary and start writing down all of these things every day, have a little journal, and then you'll be able to piece it all together. Same here. I eat all those seeds on a regular basis. Okay, so the issue with eating all of those seeds on a regular basis is that if you're eating the progesterone seeds when you shouldn't be having progesterone, that's not a good thing either. So you can eat the estrogen seeds on a regular basis if you don't have high levels of estrogen. If you're someone who has fibroids, heavy bleeding, ovarian cysts, all that sort of stuff, you should not be eating any of these estrogen seeds. You should stay away from the chia, stay away from the flax, stay away from the pumpkin, because you don't want to add extra estrogen on top of the estrogen you already have. And if you're doing the the sunflower and sesame seeds, you should only be doing those after you know you have ovulated until your next period. So don't eat all those seeds on a regular basis every day. Eating based on your cycle. So if you just start like doing Google searches and looking for, natural medicine, alternative medicine, individuals who speak about seed cycling, speak about different foods and how those foods provide more estrogen or progesterone or help to balance hormones, you might be able to get some information from there. I don't have a particular website that I like or anything else. It's just really, from reading and trying new things. But it's a little challenging because, all of the recommendations I give are based on testing patients and actually giving them the treatments and seeing if those treatments work. So it's really hard to give you guys individual plans without knowing exactly what your blood work is and what your history is. Having no period for about 8 months, will ovulation take place? Yeah, typically if you have not had a period for an entire year, then you should be done. But even if you haven't had a period for 8 months, it is still possible that you may have like another breakthrough ovulation and have a period, and then you may have to wait another entire year before you would say that you're menopausal. If you're 44 years old, then it is a little bit concerning that you haven't had a period for 8 months. So I would definitely look into that. What does thick mucus discharge indicate? It means that you have a higher level of progesterone at that time. So you've probably passed ovulation and it's no longer stretchy. I also recently found out that I have adenomyosis. So adenomyosis is similar to endometriosis in that little bits of the inner lining of the uterus, rather than implanting outside of the uterus, they're burrowing into the muscle layer of the uterus. So the uterus has 3 layers. It's got the inner layer that sheds its lining every month. It's got the muscle layer on top of that, and then it's got the skin of the uterus. So think of it as like a pear. And so if you have the inner lining of the uterus that is creeping into the muscle layer of the uterus, that's what adenomyosis is. And it causes the uterus to be boggy. It causes the uterus to have heavy bleeding. And, you know, honestly, the only things that I know to help with adenomyosis really are trying to reduce inflammation and trying to change your diet and eat healthy and try and reduce estrogen in those ways. There are, like, using just ibuprofen helps to reduce bleedings at times, but you know, who wants to be taking ibuprofen in huge doses for the rest of your life? You know, that's not good for your stomach either. So really, so many of our medical problems will improve if we just modify our diet and change our exercise and things like that as well. I use an app to track period. Is this accurate? It tells me when I'm ovulating. No, it's not accurate. So the apps to track your period are based on the calendar method. The calendar method is one of the worst natural family planning methods out there because it is going to assume that everybody ovulates on day 14 of the cycle. So when you put your period date in, it will spit out an ovulation date that is 14 days later. Then when you put in your next period date, if you look backwards, it's going to change that ovulation date and move it backwards so that it's now 14 days before your period. So it's assuming that everybody has 14 days of a second half of their cycle, not taking into account that people have lower levels of progesterone and that their second half of their cycle will shrink, not taking into account that sometimes as people's egg quality decreases, they're ovulating earlier in the cycle. So all of these things, not taking into account that your mother-in-law came to visit you, and so now you're super stressed out, and so now you're ovulating later in the month. So yeah, those calendar method apps, they're horrible. Don't use those. You can use them to track your stuff, but don't trust the ovulation. You have to understand how to pick up the ovulation based on your mucus method. That is the best thing that you've got going for you. If you have access to, you know, a clear blue monitor where you can check the estrogen and progesterone levels, or at least the presence of the LH surge and the estrogen, then if you can access that, that's wonderful. And that will give you a backup to, you know, kind of fortify your findings from your mucus so that you can be certain that like what I'm seeing is actually correct. But if you can't access any of those things, then mucus is totally your friend and it'll help you understand what's going on. I use an app. Okay, we did that one. Not sure if that's how it's spelled. Okay, I think that was from earlier. Adenomyosis. Got it. Okay, 41. I've always bled for 7 days with fatigue and headaches. I'm sorry. Fatigue is more pronounced as I get older. I've been doing blood tests, thyroid, only slightly anemic, no fibroids or cysts. Should I now check hormones after checking ovulation? Wondering next step because I would like to feel better. I'd like you to feel better too. So if you're bleeding for 7 days, then you have to wonder, during that bleed, are you having a couple of days that are very, very heavy? If you're having a couple of days that are very, very heavy, it might be that you're anemic and your iron levels are low. So make sure that they're checking your iron levels, and make sure that you're getting adequate amounts of green leafy vegetables to have adequate amounts of iron in your system, taking other sources of iron if need be. Fatigue and headaches. Make sure that you are very well hydrated with water. So any caffeine sources that you are drinking, coffees, teas, Coca-Cola, chocolate, cut all of those out, because all of those caffeinated beverages will dehydrate you, and any juices, all the sugar in there will dehydrate you. And when you don't have enough water in your system, you're naturally going to have headaches, and you're going to have fatigue as well. Cortisol levels, when you get stressed out, or if you drink too much caffeine, your cortisol levels go high, high, high. And then when your body runs out of the building blocks for the cortisol, it's going to steal from the progesterone. So it lowers your progesterone further. And if you are having headaches and feeling tired and exhausted right before your periods, then you may have lower levels of progesterone, because if you're bleeding for 7 days, it may be that the last few days are tail end brown bleeding at the end there. And if that's the case, then you can always use the Billings method, try and figure out exactly when you're ovulating. See if your doctor will be willing to write you even just one test on a peak +7 level for estrogen and progesterone. So 7 days after your peak day, your last day of stretchy mucus. And if he does that test, and if that shows that, your estrogen level is over 120, then you know that your estrogen is high. If he shows that your progesterone level is under 15, then you know that it's low. So if your progesterone is low, you can always try the seeds, the sesame, the sunflower, and see if that makes you feel better. But really, trying to make sure that you're trying to get some exercise in there, but more than anything, drink tons of water, at least, the 8 to 10 glasses a day, and try and really eliminate all of the toxins that you have in your life. So your thyroid being okay, just make sure that that TSH level isn't over 2.5. If it's over 2.5, then you might need some antibody tests for your thyroid. If those antibody tests are positive, then there may be some supplements that you can take to reduce the antibodies as well to help you feel better. No fibroids or cysts, so that's good. That doesn't sound like maybe you don't have as much of a higher level of estrogen. Could I check hormones after checking ovulation? Absolutely. If you can find a doctor that'll write you, a few estrogen and progesterone levels, and if you can know what they mean in comparison to where that ovulation is, then you're headed in the right direction. I may have missed it as I stepped away for a few minutes. What can be done to improve or control mood swings? My family has always known when it's time to stay away from mom. Oh, absolutely. So what I would say is, for sure, you want to cut out all the sugar and add in exercise, because when you decrease sugar intake, you decrease white carb intake, and you're eating lots of fruits and vegetables. It's really interesting, because I had horrible PMS. Like, I would go from the day before my PMS hit, the things that my kids would do and say would not bother me whatsoever. I'd be like, oh, you guys are so silly. The following day, the minute that that shift happened and my progesterone levels dropped, the same things that they were doing the day before, it would feel like fingernails on a chalkboard. It was just, I would go from feeling totally fine with them being crazy to wanting to run away and hide in my closet because it was so irritating. And what I found, I started using the progesterone for 10 nights. It would take it at night right before I went to sleep, and I felt so much better. But over this month, by changing to a plant-based diet, I have not had to take my progesterone like that. I've been feeling really great, and it's because I cut out sugar, and I cut out meat, and I cut out eggs, and I cut out dairy, and I've just been eating like whole grains and tons of fruits and tons of vegetables, tons of beans and like garbanzo beans and beans and rice and all sorts of really great stuff. It's been so delicious. but I have not had any meat with extra added hormones and all of the extra stuff. And it's been amazing. So if you're really suffering, if your family really understands when you are PMSing because you're feeling so poorly, then it's definitely worthwhile checking out that documentary I mentioned, The Game Changers, and looking at that website, which is called forksoverknives.com. And it's got tons of recipes on there for plant-based eating. Sorry, my doggy's trying to get up here. Oh, are you coming? Hold on one second. So, forksoverknives.com is the website, and it's a really wonderful plant-based website. So let's see what the other questions are. Let's see. I'm POS, experience vaginal bleeding post-intercourse. Okay, so if you have polycystic ovarian syndrome, then there is a possibility that the inner lining of your uterus is thicker and that you probably have a higher risk of having polyps or abnormalities in your lining. So you definitely need to go to the doctor and have an ultrasound done. When they give you an ultrasound prescription, make sure you get it done early in the cycle, like on day 5 to 7 of your cycle. First day of your bleeding is day 1. Because if you get it done in the middle of the cycle or towards the end of the cycle, they will not be able to tell if anything is wrong. But if you get it done at the beginning of the cycle, then they will know that the lining should only be like 7 millimeters. So if you come back with a lining of 12 or 14 millimeters, that's obviously thickened, and you tell them this was done on day 5 to 7, right? So my ovaries should be quiet. There shouldn't be any cysts, and my lining should be really thin. What do you think, doc? What do you think about this ultrasound? You'll help them to be able to interpret it in the right way if you do it that way. My ferritin level was also low. Now I have to take iron supplements and B12 because I was so exhausted and tired, foggy brain, forgetting, but now gaining back energy levels. Yeah, if you're super anemic, then you're gonna feel very poorly, especially if you're bleeding out every month. One thing that you can do if you're having very heavy bleeding is to try that just ibuprofen, 600 milligrams every 8 hours with food while you're bleeding to reduce your bleeding by about 30%. But you want to really go deeper than that and have an understanding of why you are bleeding heavily so that you can change those things rather than just covering it up with the ibuprofen. I have a 7-month-old baby and my period has returned and comes 38 to 45 days apart. Should I be worried? Yep. If your baby is 7 months old by now, and if you're not breastfeeding, like if you are breastfeeding, then you might still have some irregular cycles. But if you're not breastfeeding at this point and you're having cycles every 38 to 45 days, I would get your thyroid checked. I would get your polycystic ovarian syndrome labs checked and just see if there's anything else going on. What natural remedy could you suggest for persons with polycystic ovarian syndrome and vaginal bleeding after intercourse? I think we already addressed that a little bit. So natural things, number 1, get rid of the sugar. Number 2, drink lots of water, eat healthy, cut out all the carbs, and try and switch to a plant-based diet. And there is a supplement called myo-inositol. You can get it on Amazon. Do you guys have access to Amazon, Trinidad? Yeah? Okay, great. So it's called...
Yes, you do.
Awesome. So it's called myo-inositol and D-Chiro. Myo-inositol and D-Chiro. And you can look that up and you can take that supplement every day. It's kind of like an alternative for metformin. Oftentimes doctors will try and put you on metformin or glucophage to reduce your insulin resistance when you have PCOS. But myo-inositol is very helpful and it is all natural. Let's see.
Sorry, Doc. We also have a naturopath, Dr. Anna Maria Pouchet. So if anybody wants that information, how to contact her, she's a naturopath who is available to us here in Trinidad. She's actually one of our Billings and trainees.
Oh, fantastic. So does she do muscle testing? Do you know?
Not to my knowledge, but I know she has the myo-inositol.
Okay, good. Yeah. So myo-inositol is fantastic for people who have polycystic ovarian syndrome. But the use of that and understanding if they have a lack of progesterone would be helpful, because typically people with PCO need that progesterone help in the second half of the cycle to help them cycle more regularly. Okay, I've noticed that for the past 18 months, I've been having migraines 2 to 3 days before my period. Yep. Within the last 5 months, I've been having migraines 2 weeks after my period. Is this due to too much progesterone? I've changed my diet and become vegetarian. I have flax seeds in my fruit punch about once a week. What else can I do to avoid the migraines? So fruit punch, sounds like you're drinking sugar there. So maybe switch to water. Make sure that actually check your progesterone and estrogen levels after ovulation until your period, so that you have an understanding of what those levels are and have somebody interpret them to tell you if they're high or low. And then they can tell you, maybe this naturopath can help you to figure out the proper supplementation that you need in the second half of the cycle. But typically when people are having migraine headaches, it's usually because of a drastic drop in their estrogen or in their progesterone right at that time. So the flax seeds, just taking them once in a while usually doesn't do anything. Like, it has to be a daily thing. Like, I do about 2 tablespoons of the ground flax seeds mixed into a smoothie. My mom is turning 69 and still has not gone through menopause, though she has pretty spaced out periods. Is that normal at all? Does that mean that I may have late menopause? Since that is very strange, and I would definitely have her evaluated. I would get, typically, like, I have seen women who carry on without hitting menopause until maximum late 50s, like 59, 57, but I've never seen a woman who is 69 and still having regular periods. So I would definitely have her evaluated. I would check her uterus, make sure that it's not that she's bleeding because she has some abnormality in her lining, and not that she's actually cycling. Like, sometimes people will just have an overgrowth of lining that will just be shedding intermittently, and it'll seem like she's having a period, but she's actually having abnormal bleeding. So please have her get an ultrasound and look at that and just make sure that there's nothing else going on. Does that mean that I may also have late menopause? If it turns out that she actually is still perimenopausal, which would be really interesting, yeah, I guess that would mean that you would have a higher chance of that too. She has been going to a doctor, but there hasn't been any definitive reason she is still getting a period. Hopefully they're checking an ultrasound. I have, and also maybe like a bleeding disorder. Just make sure she doesn't have any sort of blood clotting disorders and stuff that might be leading to her having abnormal bleeding. I have a lot of blood clots for the first 4 days and it lasts 7 days. So you have very heavy bleeding. So I would definitely get an ultrasound and look for possibilities of causes for the heavy bleeding. Fibroids, polyps, abnormalities with blood clotting disorders. If you have a lot of extra tissue on your body, if you're overweight, all of the fat cells on your body are also creating more estrogen. So by losing weight, you're going to be decreasing the amount of estrogen that your uterus is seeing. My first question about no period for 8 months was about my 23-year-old daughter. Is there anything you can do to regulate her cycle? And my question is, yeah, so if somebody is 23 years old and has not had a period for 8 months, you have to look at, did anything change prior to that time? Did they have a sudden weight loss? Is there any possibility they might be pregnant? Is there any possibility, you know, of something else going on? Do they have headaches? Do they have visual changes? So you have to kind of do a panel of all these different hormones to check for polycystic ovarian syndrome. They can be given progesterone for 10 days to see if they'll get a withdrawal bleed. And at the time of that withdrawal bleed, then you can check all these other labs. On day 3 of that bleed, you can check all the polycystic ovarian syndrome labs. You can check an ultrasound to look at the uterus, all of those things. My question is, I seem to be ovulating a lot and I'm scared of getting pregnant every time I have intercourse. Is this normal at my age? So definitely as we get older, your cycles tend to get shorter and you tend to be ovulating earlier. the way that you can understand when you're fertile and when you're not fertile is by understanding this Billings method. And then you'll know when you can conceive and when you can't conceive. And if you have lower levels of progesterone and you actually treat it, then you're going to be buying yourself some extra days, because during the time that you take progesterone after your ovulation, those are all days where you're no longer fertile, but you're extending the time of your cycle. So those are additional days that you can use with your spouse to come together, which will not be fertile days. Yeah, that's the forksovernice.com is correct. My mother is going through menopause and takes no supplements, no estrogen pills. Are they necessary? No, I don't like writing for estrogen pills, because estrogen pills will increase your risk of breast cancer. I agree with her. I don't like taking pills either. If she has menopausal symptoms with hot flashes and whatnot, she can use, if she doesn't have any risk of breast cancer, if nobody in her family, her sisters, her mother, they didn't have breast cancer, ovarian cancer, she can always use a little bit of chia seed or flax seed every day, like 1 or 2 teaspoons ground in her food, and that might help to reduce her symptoms. I heard vitamin D3 is good for moodiness. Vitamin D3 is really good for egg health. So vitamin D3 and fish oil and coenzyme Q10 are the 3 supplements that are great for egg health. And if you have better follicles, better egg follicles, that means that you'll have better ovulations, and better ovulations mean you'll have better hormones, and better hormones mean you'll have less moodiness. So yeah, in a roundabout way, yeah. Massive panic attacks during ovulation, doctor prescribed Lexapro. Yeah, typically they do. Menstruation every 4 months, had normal bleeding up to 4 years ago. PCOS before kids, none after kids. Sounds like your PCOS is back if you're only bleeding every 4 months. So I would definitely say you would benefit from having an understanding of your estrogen and progesterone and actually trying to supplement back with those things at the correct time. You sound like you'd be a really good person for the naturopath to work with. My daughter has a lot of pain on the first day of her period. Where is this doctor located in Trinidad? That's a question for you. If you're having a lot of pain during your periods, you have to figure out if the pain is because of heavy bleeding and it's just the uterus is trying to push out clots, so it's very painful, or if the pain is occurring even when it's light bleeding. So if it's happening even when it's light bleeding, then it sounds like endometriosis, where little bits of the lining will implant outside of the uterus, and that can be very painful. There is a supplement, which maybe the naturopath has access to, called N-acetylcysteine. It's NAC. And you can use NAC along with the fish oil, along with the Motrin and stuff like that to reduce the pain. But the NAC, the way you take it is 300 milligrams 3 times a day, every Monday, Tuesday, Wednesday of the cycle. And you just keep taking it week by week. And after about 3 months, that pain should help. It should improve. Can you recommend something for hot flashes and mood swings? So the hot flashes, it all depends on if hot flashes typically are because of dropping estrogen levels, and it all depends on your family history. If you have a higher incidence of breast cancer in your family, I would not recommend anything to boost your estrogen levels. But if you don't, then you can use some of the flaxseed. Mood swings, I would check your progesterone levels and see if there's anything you can do with that. Is a minor chin hair normal or a sign of PCOS? I would think it would actually be a sign of PCOS, because people that have chin hair or hair around their nipples or hair below their belly button or a lot of hair on their buttock or on their inner thighs, all of that is usually hair growth that is occurring because of higher levels of testosterone. Spearmint tea is really good for dropping testosterone levels as well. So you could do like 3 cups of spearmint, not peppermint, spearmint tea to try and reduce those levels. But the myo-inositol is also helpful to reduce those androgens as well. Dr. Anna Maria Puchette, is pain in the ovary normal during ovulation? Some people are more sensitive to it than others. And it really depends on, are you having regular ovulations, or is this like an abnormal ovulation where you're developing a large cyst and then it pops and then you're in a lot of pain. But some people are sensitive to just normal ovulation as well. Is UTI normal in this stage? You're 42. No, it's not normal. I have noticed I got it twice, but never had a UTI in my life, plus not have had sex. Okay. So one thing is you just want to make sure that you're cutting out the sugar and the carbs and like all these things that would increase your chances of infection, because when you have bacteria in your system, it's going to increase your risk. When you're having a lot of sugar, it'll increase your risk for infection. Make sure you're drinking tons of water. Drink cranberry juice that is not sweetened. And you want to make sure that when you go to the washroom, just keep a container and just wash the area every time after you finish urinating or after you finish a bowel movement, and just pat the area dry just to get rid of any discharge or anything that may be going back up. Is there any way to naturally treat an endometrioma? That's that N-acetylcysteine supplement I was talking about. So if you get N-acetylcysteine and you take it 3 times a day on Monday, Tuesday, Wednesday of each month, of each week, then after 3 months, I would expect for your endometrioma to actually get smaller. Okay. I think I got them all.
Oh, wow. Wow, wow. We're amazed. Thank you so much, Dr. Ribeiro. That was amazing. I mean, I was just blown away the amount of questions that came through and the amount that you answered right away. Yeah, you were having fun. You said you would have fun and you had fun, all right. Okay, well, thank you all. Thank you, Dr. Barrow, for taking the time to be with us tonight. This is the first time we're hosting something like this, so I was actually a little nervous about this and even recording it when my supervisor asked if we could record. I said, I don't think so. But I'm glad we did, because you just blew out that information there so quickly that I'm like, okay, I gotta hear this again. All right. So thank you. And to all of you who attended, please come and learn the Billings method. You're thinking your app could solve everything. Your app is not your brain. All right. So your app, we have an app, okay? But the app relies on you putting the information. It's not going to guess your ovulation. You're going to tell it when you're ovulating. All right. So please do give us a call, 384-1659. Visit us, billingstt.com, and get on board. We have teachers who are ready to teach you. And if need be, we will give you Dr. Ribeiro's information where you can contact her as a telehealth, is it?
Yeah,
Dr.
so
Barrow?
what I do is I do coaching sessions. So I would, there's a charge involved. It's what is it, 128 US, and for about 30 minutes, I would just sit with you and get your entire health history, and then we'll pinpoint all of the problems that you're dealing with, and I would tell you exactly what tests that I would recommend ordering for you. And then if you can take that information to your physician or your practitioner and get those tests done, then we can meet for a second time and I could go over whatever results you have, and I would give you further instructions as to what you would need to do.
Okay, and I know that there's a doctor, or at least one doctor or two, who are willing to receive Dr. Ribeiro's information to work with it.
That's excellent.
So this is, yeah. So this is you work with us, and we will share all this information with you. So we hope to hear from all of you sooner than later. Thank you so much, Dr. Rivera, again, and everybody be safe. At this crazy time we're in right now, we are definitely being tested. Our hormones, if they're not testing us already, they're we have COVID to test us on top of that. So we are really, really appreciative of this tonight, and we want, and for all of you who still have questions, please do contact me afterwards at 384-1659, and I will provide as much information as I can. As I said, I myself need to play this over to remember everything what the doctor said. So we'll try, but the basic information about the method, it's a very simple method, easy to learn, simple to use. Um, some of you might want to achieve a pregnancy still at this point, but most of you all, I think you're like a little anxious about, I don't want the lanyap child right now. All right, so that we can help you with naturally without drugs or devices, but paying attention, knowing that mucus pattern to when you're ovulating, when you're not ovulating, and using that time appropriately. So we want to have not just this woman's talk, we want to have a couples talk later on. So we're gonna get a little feedback as to how that will run. And Dr. Barry, if you're open to it, you're welcome to do the couples talk with us.
All right, we'll see how it goes. All right,
And your
guys.
hubby, your husband could join in. Great.
Yeah, he's done a few with me. All right, you guys take care. God bless each and every one of you. God bless you. Take care. Lay off
God
the
bless. Take
doubles. Eat all healthy food.
I, I saw one where they put the doubles in water, so they said, "Okay, turn to seafood. Come on, doubles, turn to seafood." That was a good
All
one.
right, God bless. Bye-bye.
God bless. Have a good night. Thank you. Okay. So everyone, we're give us a call, text us, call us, give us an email, shout out.